For the posture assessment, the participant is standing comfortably with feet shoulder width apart and arms placed to the side. From the anterior view, the kinetic chain checkpoints include shoulders, head, the lumbopelvic hip complex, along with the knees, ankles, and feet. At a quick glance, her head is in a neutral position with her shoulders leveled. At the LPHC, however, there are some abnormalities. It looks as if her right hip is slightly raised compared to the left side. This results in the body looking like most of her weight is being placed on the left side. Her knees look to be in a neutral position as well, in line with the toes. Going down towards the ankles and feet, however, they look as if they are pronating inward slightly. These issues can eventually relate to other injuries such as shin splints and patellar tendonitis, all in which is what the participant has had before. With the 4-week exercise included, hopefully it will delay or prevent those injuries from firing up again. On the lateral side, it is evident that the head along with the shoulders are slightly rolling forward. It's by no means a severe case, but she might have, if anything, a little case of upper cross syndrome. As for the lower back, there is an arch along with an anterior pelvic tilt. Here she also may have the lower cross syndrome. This is due to an increased lumbar lordosis, which is a curve within the back. As we travel down, there is slight hyperextension within the knees, but that is due from the pelvic tilt. The feet seem to be in good position, but looks as if she is putting most of her weight on the outside foot, which could cause peroneal tendonitis along the road if not fixed. From a posterior view, as stated before, the right hip is raised higher than the left, along with the shoulders leaning forward a tad. The knees look aligned, and again her feet pronate inwards, which could be due to being flat-footed. Into the overhead squat, the participant's arms are slightly bending at the elbows. As we go through the full motion, you can see she is controlled for the most part during the eccentric phase, but right when she moves concentrically back into the starting position, her right hip pops forward a tad, which is primarily from her having a tilt within the pelvic region. On the lateral side, just like from the anterior side, her arms are slightly bent and there is also a slight lean forward. As she progresses through the motion, she does have a hard time holding arms overhead. This is a shoulder compensation as the exercise can be tough. Her back does continue to have an arch. This is another compensation for the LPHC. As for her knees, they seem to be rotating inwards primarily during the eccentric phase and locking slightly during the concentric phase. From the posterior angle, her arms continue to lean forward with the elbows bent, along with her head and chest. As for the LPHC, there is an asymmetric weight shift. This could be the reason that her body seems to sway towards the right during the eccentric phase. Just like the anterior view, her right hip continues to pop forward when she reaches the starting position. Her feet do continue to pronate inwards, as most of her weight does seem to be on the inside of her feet by the arches. As one of the harder exercises, the single leg squat, the participant does seem to compensate quite a bit. Her upper body leans forward and her shoulders begin to shrug, especially on the left side. This is a result from an inward trunk rotation. Not only that, but her hips hike up, primarily on the left side, also considered a compensation for the LPHC. As for her knees, the right knee rotates inwards, while her left leg is bent and rotates toward the right leg to help with balance. Her right foot continues to pronate inwards with the weight bearing on the inner foot. Laterally, her shoulders shrug and roll forward, but her head maintains to stay in a neutral position. Her back does noticeably have a slight roll forward. With her left leg out front, her right knee compensates a lot by rolling inwards. As for her feet, most of her body weight does continue to sit on the inside of her right foot. Continuing with the lateral view, but this time with the right leg straight, starting with her head, there is a lean forward and the upper body continues to roll forward as well. Not only that, but her shoulders do continue to shrug as a way to help with the exercise. Her left knee looks to be rolling inward as her right leg bends a lot as she tries to find balance. From a posterior viewpoint, her shoulders shrug with her body rolling forward. As for the right hip, there continues to be a raise compared to the left side. Her left knee begins to roll inwards during the eccentric motion. Also, her ankles continue to roll inwards, with a lot of pressure placed on the arches of her feet. For the full gait analysis, her head was leaning forward a tad, with her shoulders rolling forward as well. As for her back, it was arched, and I noticed there was rotation within the LPHC, along with hips being slightly hiked. The knees were in a good neutral position, the ankles pronated inwards, and her foot landed in a heel-toe strike, with the feet flattening with each step. The Davies test consisted of 2 exercises, one being jumping jacks and the other box jumps. For the jumping jacks, the participant completed 5 reps in each position, anterior, lateral, and posterior. As she went through the exercise anteriorly, she was in control the entire time with her head in a neutral position, with her arms moving in a controlled motion at a steady pace, as well as her shoulders. Her knees were also in a neutral position with no excessive rotation. As for her foot position and landing, the feet landed within the forefoot, and there was also very little pronation. For the lateral viewpoint, she was in a controlled motion the entire time with good form and very little flaws. The only issue I can see is the back is arched slightly due to a pelvic tilt, and her upper body has a slight lean forward. From a posterior angle, she has excellent form, with her head in a neutral position, looking forward with her upper body upright. Her knees look good as well. The only issue I can see from this viewpoint is that her ankles are beginning to pronate inwards, with their feet ever so slightly rotating outwards. For the last movement analysis, I had the participant complete the box jump. This is a good representation of how the body moves and coordinates together while doing a taxing exercise of jumping on a box. From the anterior viewpoint, her head continuously looked down for the entirety of the exercise, which is understandable as it is a conceptually difficult movement to master. As a result, her upper body has leaned forward excessively. The arms were doing most of the work as she was trying to launch herself forward in an uncontrolled motion, when she should have been firing her lower body, specifically her glutes. At a lateral angle, her head and upper body continued to lean forward. Her shoulders were rolled along with the arms reaching forward and doing most of the work. Her back was arched in the starting position all the way up until she hit the box. Then I noticed a slight roll in her back. As for the knees, they were in a good neutral position, as well as her feet, which she landed on her forefoot for the entire exercise. Finally, for the posterior angle, she continued to have issues, especially within the upper body, but that is common, as this is a hard exercise to complete, especially after doing all the prior testing. Overall, she has great potential to fix all the minute flaws I have stated above, and I am very thankful she was willing to complete this assessment for me. Thank you for watching.